All right, thank you for staying with the Monday Report. I see a lot of your feedback coming through. The hashtag is Monday Reporter. Trevor Mbija at Citizen TV Kenya. Let's see what you're saying on video before I get into the questions on Twitter really briefly.
That the government, through its Civil Servant Commission, is coercing people to take the vaccines without knowing the long-term side effects. Do people not have the right to make their own decisions in matters to deal with their health? Or is it a must that I take the vaccine in order to work for the government? What if that is not what I want?
Yes, DG.
I told you, thank you for that. So the government makes policies on a day-to-day basis depending on the situation that is at hand. And for this particular one, we've known that it's safer to have the vaccine. The benefits of the vaccine outweigh the side effects. And remember, even if you're required to travel, say, to South Africa or Senegal or Thailand for that particular matter, you require a yellow fever vaccine, which is mandatory, and you have no choice. So if you want to travel, either you have the vaccine or you don't travel.
Yeah.
So based on this, because the vaccines are available, and the government requires that the civil service continues to function optimally, yeah, by ensuring that civil servants are their desks or places of work to be able to deliver services, and the vaccines are available. It was thought prudent that the civil servants then be at the forefront in taking the vaccine. And as I said, it's not only what the government wants, but it's your civic duty and your patriotic duty to ensure that you take the vaccine, not only for your protection, but also for protection of your loved ones and protection of your community. And that's the only way, as a global community, we can be able to overcome this pandemic.
Yeah. DG, are there any exceptions? Because I see here DJ says, ask the DG, should I go ahead and take the vaccine despite having recently recovered from COVID-19 just to adhere to the government directive on mandatory vaccination for civil servants?
If you give us proof that you have just recovered, and of course, if we test you, we send you a copy of that test result, then that will be an exception for you getting the vaccine.
Okay. All right, let's see what else you're saying on video.
I think the government should be able to prioritize vaccinations in terms of ensuring that there is a high number of people who are vaccinated in a day. Again, there is need to prioritize the testing capacity so that we can be able to have, even handle the cases so that they don't spread. So the testing and increasing the number of vaccination is actually very critical.
You already talked about increasing the number of vaccination on that. Let's bring up the next one.
Mbona Kenya sifanya procurement wenyewe ya vaccines? One issue ni unatajia tu donation from other countries.
DG, why can't you do our own procurement depending on
Thank you. We have placed an order for AstraZeneca vaccine to the tune of 13.3 million doses. However, because of global manufacturing constraints, all this we cannot be able to get in a single day because of demand from the rest of the global community. So this will come in a staggered way on a monthly basis. Starting with the end of this month, we'll get close to 400,000 Johnson & Johnson vaccine, and thereafter, hopefully, we'll be able to get a tranche of 500,000 every month until we clear that 13.3 million. And that has been procured using Government of Kenya own resources.
Okay, let's bring up another video.
A good percentage of Kenyans who have been vaccinated have reported various side effects of the vaccine. Should Kenyans be worried when going to take this vaccine that there will be severe side effects of the vaccine?
DG?
I'll just repeat myself because I alluded to that matter.
Yeah.
Based on the data we get from the pharmacovigilance platform, that is our monitoring system for adverse events following immunization, we've recorded 615 cases of adverse events following immunization. And as I said earlier, most of these events have been mild, including pain and soreness at the injection site, fever, feeling chills, headache, joint pain, muscle pain, nausea, vomiting. I told you a few women have reported excess menstrual flow or menorrhagia. We have not recorded any single death as a result of vaccine administration. Neither have we recorded a case of blood clot following administration of the vaccine that we are deploying.
All right, let's bring up another video question.
we are seeing other European countries are back to normalcy with their activities. Even when it comes to football and the sporting activities are back to normal with spectators in the field. What are these other countries doing that Kenya cannot do or African countries cannot do to resume normalcy?
You also alluded to the issue of resuming normalcy and what it would take. Let's bring up another video question as well.
Do you think the vaccination of teachers only is the silver bullet? What about the student? What about the people? Are there plans that are there underway?
Okay.
Thank you. And correctly put, we have prioritized in terms of our deployment based on the risk characteristics of the individuals. I told you about the data regarding death, that those who are more than 50 years, if you look at the mortality, even for the past 2 days of reporting, more than 90% of the mortalities are those who are aged 50 years and above. Based on that, and because of scarcity of vaccines, we came up with a plan trying to target priority groups. Remember, we started with healthcare workers, the security people, the teachers. And if you look at the profile of the risk of the students or pupils in school, their risk profile is lower. So because of the scarcity of the vaccines, then you need to deploy it where you are going to get greatest dividend. Yeah. That is probably you need to start with the teachers before you get to the pupils. Though we now have data that you can be able to vaccinate those who are 12 years and above. And as more vaccines become available, we will go downstream until we get to the 12-year-olds.
Yeah. What kind of data are you seeing in terms of the Delta variant, DG? Is it more lethal, and is it the one causing more death now? And is it most likely to mutate again?
The Delta variant is more transmissible. That is obvious. About 60% more transmissible than the Alpha, the Beta variant. And because it is more transmissible, then it's easier for you to be able to pass it from one person to the other. And if you increase transmission levels, then more people will get sick. And if more people get sick, then the health facilities will be clogged. And of course, because of that, some mortalities will occur. So in our situation, we are seeing slightly increased number of deaths, and we ascribe this to the Delta variant. But also, if you overstretch the healthcare system, or if you stretch it too much, it does not matter which variant you are dealing with, mortalities are likely to occur. But fortunately, AstraZeneca, Pfizer, all the WHO pre-qualified vaccines work very well for the Delta variant. And my plea to Kenyans is that now the vaccines are available, please go out and take your vaccine so that you are protected.
And what is data showing you about mixing and matching? If you got the first or even the second dose of AstraZeneca, can you now mix with Moderna that is here? Can you also take the Johnson & Johnson, which is just a single shot?
Thanks for that, Trevor. Data, especially from Europe, Canada, Spain, those are the people who started the mix and match or prime and boost. There's another name for it. You prime with the first dose, and then you boost the immune response with the second dose. That has been done. Data is still very, very scanty, but shows clearly that the prime and boost shows a better immune response, especially if you start with AstraZeneca and then you get the messenger RNA vaccine, then you get a better immune response. But because we may not be able to have access to these mRNA vaccines as a country or as a Sahara Africa, I think we'll still go with our standard 2 doses of either AstraZeneca or single shot Johnson & Johnson, Sinopharm, and the other vaccines. Of course, if more data becomes available, then we'll be able to change our policy guided by that.
All right. And Nelson Kabando says, today I convinced my friend to go to for the COVID jab. I accompanied him to Athi River Level 4 hospital. To our shock, you have to part with 50 shillings to get the jab. That amount made many people leave without being vaccinated. Is there anywhere where somebody should pay for this jab?
The vaccines are procured by the government either through the COVAX facility or through GOK's funds, and therefore nobody is expected to pay a single cent for that service. Not in a private health facility, not in a public health facility. And we'll be able to pick up that matter with Machakos, with the Machakos Department of Health to see to it that that is stopped forthwith.
Okay. Lily Waz says, is the vaccine safe for expectant women?
Very good question. Emerging evidence from our own Kenya Obstetric and Gynecological Society, American College of Obstetrics and Gynecology, the Royal College of Obstetrics and Gynecology clearly shows that the benefits of giving the vaccine to pregnant women far outweighs the risks associated with giving the vaccine in pregnancy. Pregnant women tend to get a more severe form of COVID because pregnancy is a state where your immune response is slightly reduced because you are carrying a baby whose genetic composition, half of it is from the father and half from the mother. So for the baby to be able to stay in utero, your immunity is suppressed a bit during pregnancy. And pregnant women also tend to have poorer outcomes. They tend to end up in ICU. They tend to have preterm births. And of course, if they have preterm births, then the babies have to be taken care of neonatal ICUs, which is very expensive, or they have stillborns. The baby is born dead. So it is very, very safe for pregnant women to take the vaccine.
All right. Joe is saying, ask the DG, there's so many coming through, I just missed that one. Joe is saying that ask the DG to comment on the booster vaccine, especially to those who have taken both jabs. Do you need another one?
For now, we don't need another booster vaccine because, remember I told you, we have only fully vaccinated 2.9% of our population, target population.
Yeah.
So why would you get a third one when your sister, your brother has not even gotten the first one?
Okay.
In terms of equity, let's ensure that we reach our target population. Then as more data emerges, then we'll be able to make a decision whether you require a booster.
Okay. Aryan Patel says, when will vaccines be available for 16-year-olds, since latest research shows that Pfizer and Moderna vaccines are suitable for 16-year-olds?
Thanks, Trevor. I told you we can be able to give the vaccines to 12-year-olds and above.
Yeah.
But based on our risk profile for now,
yeah,
we have a higher proportion of people who are still not protected, who require to be prioritized first before the 16-year-olds. And when the vaccines become available, we will again eventually deploy them downstream even to 12-year-olds.
Okay. Angela Razaro says, what are the side effects of staying for long duration before receiving the second vaccine in between here?
The main side effect is because we have what we call the memory cells. In your body, there are cells that when we give you the first shot of the vaccine, they try to remember that you have been exposed to this particular antigen. And when you get the second or the booster vaccine, then they mount what we call a very strong immune response. If that lag period is very long, then the memory cells tend to forget. And therefore, if you are given the second shot, you may not be able to mount a significant immune response. So please try as much as possible to stick to the timeline that you are given by the healthcare workers. If that time is exceeded beyond a certain limit, then we have to start the vaccination process afresh.
Okay, let's see what else. In fact, Sergio here, I think Sergio Anthony Agatha is actually a doctor, because he says our bodies produce antibodies after an infection and their memory cells as well. Why is it so different from this COVID infection, or is it because of the different mutations that we have to get the vaccine?
He has, of course, answered the question himself.
Because of the Okay, I think we have to take a quick break now. When we come back, we'll take some quick closing remarks, and also I still see a few that I'll try and sneak in here. Wekesa Javan, I see your question. I also see Mzalendo's question. We'll pose those questions to the DG as we wrap up on this. See you in a bit. All right, let's sneak in your last questions before we wind up for the night. Eve Oryx says, kindly ask the doctor, July has been a cold month. Most of us had coughs and colds, which we treated like normal colds without testing. Is it advisable to get tested first before we get the vaccine?
It is not advisable to be able to get tested before you get the vaccine. But if you happen to be tested and you turn out positive again, as I said, you need to wait for about 3 to 6 months before you go for the vaccine.
Yeah.
Ordinarily, you don't require a test before you get the vaccine.
Okay. And that's the same question Wekesa Javan is asking. He said, you kindly ask Daktari, what happens when someone who is infected by COVID-19 but doesn't know he's infected is vaccinated? So he has the virus and is given the vaccine.
And of course, such a person, because they will be able to mount a stronger immune reaction, may be able to record an increased possibility of the side effects that I mentioned earlier, including fever, headache. They may be exaggerated. They may last 2-3 days instead of the normal 1 to 2 days.
Okay. Jaro Soja, he calls himself Gor Mahia Fan 001, says, kindly ask Dr. Moth to bring vaccinations door to door, and even in schools, we need to go back to the stadium.
I think I mentioned that we are going to increase our vaccination delivery system from the current 800 posts to 3,000 posts by September. And of course, we are going to do mobile outreaches, and of course, we are also going to do mass campaigns. However, it may not be possible to do this kind of vaccination door to door because it's an injectable vaccine. That is usually easy for an oral vaccine like polio, because now you'll have to deal with the issues of infection prevention. How are you going to be able to handle the needles and take care of the other ways that are going to be generated and ensure protection of the rest of the community.
Okay. Finally here, Marco P. Kimani says, so if world over there's currently a fourth wave of the pandemic persisting, so why does Kenya continue having curfews while some countries, especially in Europe, did away with it? Does the virus only spread at night during curfew between 10 p.m. and 4 a.m.?
The virus spreads anytime. It does not matter whether 10 p.m. or 10 a.m. Curfews, one of the things that you need to know about the spread of this virus is when people are congregated in a space, the 3 C's, closed spaces, crowded places, and close contact. Yeah. That is the main driver of transmission of this vaccine. So that curfew is basically to be able to limit the movement and therefore avoid these scenarios. And you remember that our very nature, especially as Kenyans, we tend to congregate in the evening after a hard day's work to be able to relax and enjoy with our friends. And of course, whatever we take, again, it is very difficult to be able to maintain the other public health social measures, including physical distancing, wearing your masks, and therefore, potentially, that could portend an increased risk of transmission.
Okay. Pastor Ashford Mirengu, Riruta MCA aspirant, says, hi, Trevor. Ask the doctor, why not allow people to choose which vaccine to use?
Oh, that we are not going to allow because, one, we'll have a superiority competition. People will start saying this one is better than this. But I told you from the beginning, the vaccines equally, all pre-qualified vaccines by the WHO protect you from severe infection, hospitalization, and risk of mortality. Yeah. So if you make you choose, and today we only have AstraZeneca, and your choice was Moderna, then our journey towards that herd immunity and be able to build back better by recovering like what has happened in the Western world will not be possible.
Yeah. All right. Dr. What are your parting shots on this? Are we winning this war in your own assessment?
Trevor, as I told you in my opening remarks, we have made significant progress towards this battle. Regrettably, of course, we have lost our lives. We have had our pitfalls, we have had missteps, but generally I think this is a pandemic that we have mounted a war very, very well. Yeah. And I think we need to be applauded for this. And if you can be able to look at even the vaccination deployment plan, yeah. The fact that very many countries are donating vaccines to Kenya is a sign of confidence that our system in terms of deployment of the vaccines is working. Remember, we got vaccines from South Sudan, we got donations from India, from UK, from Denmark, from Greece, and vaccines with a very short expiry period, and we have been able to deploy these vaccines without any significant wastage. It means that the system that we have in place between the national government, the private sector, critically the county governments, will be able to deliver for Kenyans. So Kenyans should be able to have confidence in the system, and they should be able to be informed that the vaccines are safe. It is better to get the vaccine than to get COVID. And as more vaccines come into this space, my only plea to Kenyans is, if you have not been vaccinated, please come out. And I want to plead especially those who are more than 58 years old. They form a significant proportion of our population at more than 2.6 million, about 2.6 million. Only 9.1% of that population has been fully vaccinated. I shared with you the mortality statistics. These guys, these ladies and gentlemen ought to come out clearly and get their first and second jabs so that they are protected. In case they get severe, in case they get COVID, they are likely to get a milder form of the disease. But most of them, if you get a double shot, you are literally protected from getting COVID-19.
All right. Dr. Thank you so much for making time. Dr. Patrick Amott, the Acting Director General, Ministry of Health, and also the President, WHO Executive Board, speaking to us on COVID-19 and the state of war. He says if we all work together, we will win this war. They're doing their best to ensure we all get vaccinated. And if you have anyone who's beyond 50, ensure they get vaccinated. The mortality rate is showing that they're the ones who are losing their lives at the highest rate. All right, that's it from me. My name is Trevor Mbijo. It was a pleasure having you with us again. Let's do this again on Monday, right? Good night. Have a fantastic week ahead. Bye for now.